Well, for those of us that lived through the '70s and waited on lines at the gas station based on whether your license plate was odd or even, we
Right.
remember quite well what
Yes.
price controls brought about, and they were eventually dropped. They go back many years. We have a number of reports on price controls on our website, cagw.org, issue briefs, and a lot of other information, but they have never worked because they create an artificial limit on what someone can charge on
Right.
a particular good. And in the case of biopharmaceuticals, and this happened right after the Inflation Reduction Act, it means that there will be less research and development for new drugs.
Right.
And we wrote a piece about the invisible graveyard of patients who will never get a future treatment. No one knows what that is because it hasn't been created, but it will have an impact
Right.
because especially these smaller molecule drugs make it, they're hard to create and they take a lot of money to create. It costs what, about $2 billion to create a new drug when you take
Right.
into effect all the other drugs that don't make it to the marketplace. The companies have to recoup that money and reinvest it in new drugs.
Right.
So they're not, the numbers are high because it's a large industry. But if you look at like average profits, pharmaceutical companies are not as profitable as many other companies are
Right.
because they invest so much in the research and development,
Yes.
and they have saved so many lives that it's not that they should be free to do anything, but they certainly should be free of price controls, and they should be allowed to do the continued research and development. One of the ways to fix that is faster approval by the FDA of new drugs, and then allowing them to recoup what they've spent and reinvest.
Right.
And when you go back to the first Trump administration, Council of Economic Advisors said, well, the other countries are freeloading on our research and development. We should make them pay more. And they just had an agreement with Great Britain. With Great Britain's going to pay a little more for our drugs as they come into the marketplace, which will be at least a step in the right direction. This should be part of every trade negotiation, along with intellectual property protections, but not allowing the U.S., which leads the world in biopharmaceutical research and development, to continue doing what we're doing means someone else will get that. They won't do as well, and then they'll have better control over what drugs are and are not created.